All right, so we're going to go ahead and get started. We finished the lecture in the other class, so we should have no problem finishing it today. So that means everybody make sure you take your quiz today with the exception of the following four people. We're officially in the semifinal round. So we've got Zachary Brewster, there's Zach. Grace Cooper, there's Grace, Gavin Crawford, there's Gavin, and Bryce Gambrell. Do we have Bryce today? Do not see Bryce, so I'll send an email if he does not join later. So you four do not take your quiz today. Everybody else, make sure you take your quiz before 10 a.m. on Saturday. So again, Zachary Brewster, Grace Cooper, Gavin Crawford, and Bryce Gambrell. You four will be playing in the semifinals on Monday. All right, let me pull the lecture up. Okay, so we are going to continue with the Lamb and colleagues study today. So we first discussed it a little bit on Wednesday, just sort of going through who the people were that received treatment in the system, as well as some of the demographics. So let's get more into detail. So here's how the LA County Jail determines if you need to be, or if you have a mental illness and perhaps need to be in their mental health wing. So all persons that are brought to the LA County Jail are processed through the Inmate Reception Center. And those of you that have been on the jail tour with me, it's very similar to the Al Cannon Detention Center. After you are searched, then they take your fingerprints. Then you go through the room and you will usually have your bond court hearing through webcam. And if you are not able to bond out or you are denied bail, then they will start processing you into the center. So this is the same thing that happens here. So the reception center at the LA County Jail administers a 15-item medical psychiatric questionnaire to all incoming inmates. So this is something that the booking and classification officers are going to do in every jail. They usually ask you a series of questions. A lot of them are to determine, if you have any enemies in the facility, if you have any illnesses, physical or mental, that might make you need to see a nurse, or might need to be in the mental health wing. So they have a bunch of questionnaires to ask, and at the LA County Jail, they have 15 questions that will flag them if they might have a mental illness. So if you answer yes to any of those 15 questions, or if the inmate just appears odd in any way, then they refer you to a mental health professional to determine whether you need to be admitted to the mental health wing of this particular jail. So if the psychiatric personnel determines that you should not be in the general population and that you need to be in the mental health wing, this is referred to as the Twin Towers Correctional Facility. So it's just a separate wing within the LA County facility. There are 3 areas within that mental health wing, the Twin Towers part. So there is the acute inpatient unit for those offenders who need acute treatment. So if you need to be receiving treatment immediately from a psychiatric personnel, if you're sort of going through a crisis and you need to be sort of talked down, or if you need to be administered meds, this is the acute inpatient part of that unit. They also have a lockdown area for those who need acute treatment but are also deemed to a danger to themselves or to others. Each person in the lockdown area is checked at least once every 15 minutes and is often housed alone in a single cell. And those cells are designed to not be able to injure yourself. So they might, depending on the type of crisis you're going through, they might give you one of those suicide gowns. So generally, they're just it's sort of like a green smock that it's like a sleeveless smock with long pant legs. It's kind of like a jumpsuit, and there's Velcro on either side, but the material is very thick and you cannot rip it. So you can't rip it to make a noose to hang yourself, and there's nothing in the cell that would allow you to be able to do that to yourself. And then there's just the general treatment area, which is kind of like the general population of the wing, of this mental health unit wing. So if you have been on the jail tour with me, if you've ever seen the special management unit, that is the equivalent of what we're talking about right here. We are not allowed in that unit. So when you go on a jail tour with me, they allow you into the behavioral management unit, which is like administrative segregation or the solitary confinement. It's like the jail within the jail. Like if you've been misbehaving and you can't be in the general population, the special management unit is directly across the hall and looks very similar to the behavioral management unit. It's got single cells, but the inmates are allowed to sort of mill around in the center. And then there's an outdoor area. It's like a huge concrete sort of enclosure with like slats across the top for sunshine and a little bit of wind to get in. So you can be out there, you have to be moving around, or you can be in the center, sort of chatting or writing letters and things like that. And again, keep in mind, this is not what the average local jail looks like. The Al Cannon Detention Center and the LA County Jail are very well funded, very large, well staffed facilities. A lot of little podunk jails do not have the funding. They might just have a couple of cells that they set aside for inmates with mental illnesses, and they can call psychiatric personnel on, when they need it, but they don't have them actually working in the facility. All right, so let's see what we kind of got from this study. So considering that 59 out of 78 of the inmates with a serious mental illness received the acute treatment that they needed, it can be concluded that a large percentage of the study sample of serious mentally ill offenders received the treatment that they needed in the criminal justice system. Again, we want to take that with a grain of salt because this is such a large, well-funded jail. I would not say we could generalize this to all jails. So the other thing to note about this is the wide range of crimes in which these people were admitted to the jail for. So a lot of them were there for violent crimes, about 72%, but the rest of them were in jail for fairly absurd reasons. The study gives an example of somebody they refer to as a lemon thief. So a person, one of the people that was one of these 104 that was admitted had psychiatric or was experiencing psychotic symptoms and had a previous diagnosis of schizophrenia, and was arrested for taking lemons from the property of a private residence, screaming at the lemons, and then throwing them at the lemon trees. He was arrested and charged with burglary for stealing the lemons off this private property. So the researchers of this study noted that the diversion process probably needs to be better for offenders like the lemon thief. He probably could have been diverted out of the criminal justice system, whereas perhaps the violent offenders were exactly where they needed to be in the treatment facility or the treatment wing of this facility. So since the results showed that they were able to get the mental health treatment that they needed, and since they were arrested for violent crimes, this was a good place for them. So if we just look back at the characteristics of the offenders in this jail, 92% had a history of non-adherence to meds, 72% prior violent arrests, 76% of them had a history of substance abuse, a third of them were homeless. So just looking at those characteristics, what we're seeing here is that the inmates in this study with a serious mental illness present problems in the intermediate and long-term treatment. So they're going to be kind of a challenge in any setting. Considering that 92% of them had a history of going off their psychotic meds before their current arrest, and most of them had prior arrests in general and a lot for violent arrests, they're going to present a challenge in any treatment setting. So, some recommendations that they made from this study. If we want to reverse the trend of criminalization of persons with serious mental illnesses, diversion from the criminal justice system to the mental health system needs to be a first step and a priority. Um, but if we're going to divert these people out, we need to expand the capabilities of the mental health system to take these people. So we have to have an increase in psychiatric treatment and rehabilitation resources in the community to accommodate these people with severe mental illnesses who are being diverted out of the criminal justice system. So since deinstitutionalization in the 70s, we have not made considerable progress towards making community health, mental health treatment available. So what we're hoping to see moving forward is assertive community treatment, using mental health courts to divert these people to assisted outpatient treatment. And we need to follow up with them because we know so many of them go off their meds. We need to make sure that we can keep following up with them, because when they go off their meds, when they have gaps in treatment, that's when they wind up in the criminal justice system. All right, so what I want to do now is give you an example of, specifically, I keep saying diverting them into the community to receive mental health treatment. Let me give you an example of that type of treatment. So intensive case management is an example of what can happen to a mentally ill offender who's been diverted from the criminal justice system. So ICMs, or intensive case management interventions, have been used extensively in jail diversion to help people with mental illness stay out of the criminal justice system. So researchers have identified case management as the most important component of a successful diversion program. So case management is something that we've been talking about almost all semester. Most of the offenders that we are speaking about have multiple compounded issues. So just solving one of those issues is not really going to solve the problem, which is why they need a case manager who can help them receive assistance for all of the problems that they have. So when we talk about case management in the mental health field, what we mean for them specifically is community-based intervention that focuses on services that are brought to the client in their natural environment. So this can start in the jail or the prison before they get released. We'll send the case manager to them to help them figure out what they need and to sort of start the ball moving so that they're ready for them when they get released. We also see the services brought to them directly in their home. So the case managers will visit them at their house and help them with all the things that they need. So the services are brought to the client. There's really an unlimited time frame. You never really know how long you need to work with someone with a serious mental illness. It could be 6 months, it could be 2 years. It might take someone a really long time to become stable, and then you just need to follow up with them every couple of months. It's really hard to say. Mental illness is a tough beast to figure out. The staff, the case managers, and the staff that work with them have to be available 24 hours a day. Um, they have to have a range of services provided, but they need to be available 24 hours a day, especially for crisis intervention. So some of the services they can provide would be things, and again, these are tailored to the individual need of this person. Mental health, obviously, help with housing. Remember, a lot of these people are homeless, so they'll need help finding housing. Daily living skills. A lot of them have never lived by themselves. So just things like doing laundry, doing the dishes, cleaning up after themselves, how to use a vacuum cleaner, like make your bed. These are things that these people have never had to do. So just learning about that. Socialization. A lot of these people have really tough time communicating or telling the difference between when somebody is speaking to them normally versus aggressively. A lot of them have trouble finding a job or keeping a job, so helping with employment. Crisis intervention is something that they have to be available for 24 hours a day. And of course, substance abuse treatment. We know that a lot of them have co-occurring disorders. So being able to help them with that. So just a bit more detail on those services. So again, remember the case managers go to their home and they can help them with a lot of things. So just in terms of mental health, what they can help them do is find a therapist that they get along with and to help them make appointments. They can help them transport them to those appointments. A lot of these people don't drive or have never driven before. So they need transportation to the appointments. The case manager can send one of their staff members or themselves to go pick up their prescriptions for them. A lot of these people are on a lot of meds, and so they need help picking the prescriptions up in a timely manner. They can help, like I said, scheduling and attending appointments. They can help them show where to apply for a job, and they can help them apply for a job. They can help them write their resume. They can do mock interviews. They'll be working on those communication skills while they do that. So I have a cousin who has severe epilepsy, and she has had so many bad seizures that she has a lot of brain damage, and she sort of has to deal with mental health issues because of that. But she gets angry really easily for seemingly no reason at all. So she has ICM, and her case manager works with her with mock interviews a lot, to try to help her understand that she doesn't need to get angry about certain things. So a lot of people with mental illnesses or traumatic brain injuries have trouble interpreting, um, normal communications, and how to verbally express their feelings. So this is something that they can really help them with. Um, Case managers can also help them communicate with probation and parole officers if there is one. So if they're on probation or parole, they might need help getting to the appointments, communicating with their officer, making sure they're doing all the conditions that they need to be doing. If they are in mental health court, then they're usually have a probation officer or case manager that they're working with that works with the judge, so they can help them do that stuff as well. And of course, crisis intervention. So if they have gone off their meds or they're feeling really suicidal, they feel like they're going to harm themselves or someone else, they have to have a 24-hour hotline to be able to call. Usually these case managers rotate being on call to deal with crisis intervention. So they've got a whole team of people so that they're not on call themselves 24/7. So each ICM in the jurisdiction is slightly different. I have a friend who works in ICM up in Portsmouth, New Hampshire. She and I went to USC together. She was an exercise science major, and the ICM she works for actually has her working as a fitness and nutrition mentor. So she has about maybe 15 to 20 clients, and she goes to their houses like every once a week or every a couple of times a week, and she gets them out of their house, takes them on walks. Sometimes they go swimming, sometimes they'll play tennis or racquetball, go on hikes. So she just sort of gets them out of their house, and gets them focusing a little bit on their physical fitness. She can also help them with nutrition and stuff like that. To work for this ICM, she had to undergo extensive training on spotting potential in need of crisis intervention. So she was telling me, this was pre-COVID, but she was telling me a story about how she went to a client's house and she saw this client like Monday, Wednesday, Friday. Monday, the woman was fine. They went on a nice walk around the neighborhood. She came back Wednesday. The woman didn't want to answer the door. She talked to her extensively, finally got her to open the door. The woman let her in, and she had tinfoil all over the windows and had smashed up her cell phone because she felt like people were listening in. So Tori was like, okay, just hold on just for a minute. So she called the case manager, who sent over a crisis intervention team. Turns out the woman had stopped going off her meds like the Sunday prior, and she was okay when Tori saw her on Monday, but by Wednesday she was way psychotic. So they had to get her admitted to the state hospital to get back on her meds. And I think she was in there for like 2 or 3 weeks before she got back out. And then Tori started working with her again. So that's again just another sort of example of this sort of cyclical nature of people with serious mental illnesses. They feel good, they'll go off their meds, they'll need someone to check up. If Tori hadn't been there to check up on her, her case manager probably would have seen her, within the next couple of days. But that's sort of the follow up that I was talking about, that you need to, intervene as soon as possible, so that this person doesn't go off their meds for weeks at a time.
Dr. Hill,
Yes.
this kind of reminds me of when I worked for Department of Homeland Security. We don't even know how these people would find the phone number through like a maze of online things, but they would call us and they would tell us things like, people are listening in through their television sets to them, that they're being spied on by the government, that people are talking to them through their DVD players, like all of this craziness. And there was literally nothing that we could do other than we would try to direct them back to local law enforcement in hopes that they would get help. But they would have like just call us with these crazy stories about how they're paranoid and being spied on.
Yeah, it's pretty obvious. Actually, this happened to my husband like 2 or 3 weeks ago. He is in charge of IT at the Charleston place, and there was a problematic guest who kept calling IT and saying that her phone was bugged. And Robert did everything he could do to avoid going to this woman's room. But he finally had to go to the room because she was causing such a ruckus. So him and his boss went up there, and the boss stood outside the room, like ready to call 911. And my husband's like a really big dude, and this was like a tiny little lady, but he was still like a little nervous. And he went into her room, and she like was just like clearly had been off her meds and was convinced people were bugging her phone and telling Robert that he needed to like do all these things, like take the phones out of the room, and she wanted a new phone, and she wanted him to check her laptop because she thought people were sneaking into her laptop. I mean, this went on for, 20 minutes before he was just like, all right, yeah, there's nothing I can do for you. And finally, the hotel kicked her out. Um, but yeah, it's usually pretty apparent when these people have gone off their meds. They usually have sort of paranoid delusions like this. And this is why it's really important to follow up with these people, because the longer they go without their meds, the harder it is to get them back on their meds. So ICM, they've got a couple of goals. So one of the goals is to try to keep these people out of psychiatric hospitals or other restrictive environments for the least amount of time possible. Like I said, sometimes, you got to kind of go back to get reset. They try to help them integrate or reintegrate into the community. They want to link them to community-based agencies, and to teach them how to manage their mental illness. So, effectiveness. So, the first thing that we can note from this is that ICM, when you incorporate substance abuse treatment, works best. Just quickly, if you see TX on this slide, that's shorthand for treatment. So, since we know that anywhere between 35 to 75% of people with mental illnesses have a co occurring disorder, if you incorporate substance abuse treatment into your ICM program, it works better. Which leads to the next question: how effective is this? The research has been really mixed. Researchers have concluded that ICM intervention is an essential component to diverting someone out of the criminal justice system. You can't just divert them out and expect them to seek treatment on their own. We learned that 50 years ago during the 1970s that they're not going to do it. So they need somebody to help them. But SMI or ICM is probably not sufficient to keep these people out of, an incarcerated setting completely in the future. These people have a tough time sort of surviving. And ICM is very important, but as far as like gauging the actual effectiveness of it, it's really hard to do that. The results are kind of all over the place, but these people are going to always sort of find themselves either in some sort of restrictive setting of another. So the best we can try to do is try to keep them away from future arrest. But if they're not being monitored under ICM, it will not be long before law enforcement is called. I mean, just like Ashley said, that's what you do when you see someone, acting crazy or doing something that is abnormal. You call law enforcement. And so the best thing that we can do is try to divert them into ICM and to have a case manager help them in the community. All right, questions about ICM? Okay. All right, we're going to start our last slide, and we'll probably end a little bit early here on this Friday. So last thing I want to talk about is mentally ill offenders in supermax prisons. So if you're not familiar with the supermax, it is a highly restrictive, very often technologically advanced facility. Inmates in these facilities have starkly different experiences than those that are housed in lower security prisons, even maximum security prisons. People in a supermax usually spend about 23 hours a day by themselves locked in a cell. There are very few programs for them to be a part of, and very few instances in which they can socialize with others. The main goal of a supermax prison is to incapacitate the worst of the worst. So an inmate can be placed in a supermax facility for disrupting prison operations. This can be anything from extreme violence towards other inmates, predatory behavior towards other inmates, violence and predatory behavior towards correctional staff and administrative members. Or it can just be anything from extreme disregarding of the rules. And unfortunately, sometimes people with mental illnesses find themselves in those categories. So a lot of times, supermax prisons can just consist of several, it can include nuisance inmates, such as those with serious mental illnesses. So you may recall from Wednesday when we first started talking about the way people with mental illnesses do their time. They're much more likely to be involved in a fight than the average inmate. So that sort of puts them on the radar of being moved up to a supermax prison. But they also don't communicate well, and they don't process and understand rules really well. So they can appear to be sort of recalcitrant inmates just for disregarding the rules. So my friend Amanda worked for the jail here in town for a really long time. About a year prior to COVID, she transferred to go back over to the road. So now she's a sheriff's deputy with the Charleston County Sheriff's Office. But she worked in the jail for a really long time, and she worked in, I think, Leaf and Lee prison before that. So she has an extensive experience working with inmates. And she kind of had a soft spot for mentally ill offenders, and she was an extremely patient person. So she often was the one that dealt with the mentally ill offenders. And she told me a story one time. She worked like 9 days in a row and finally got a day off. And one of her favorite inmates, who was a man with, I think he had schizophrenia, before she left, they transferred him to the behavioral management unit because he kept getting into scuffles with other inmates in the general population. The behavioral management unit is like the jail within the jail. It's like solitary confinement, and which means you eat your meals in your cell by yourself. So they would slide the tray, through the little slot, you eat your meal, and then they come back and they take your tray. Well, this man didn't want to return his tray for whatever reason. And the person on duty that day could not get him to return the tray and just got tired of dealing with his nonsense. And so they had to send in the SOG group, so the Special Operations Group, which is like SWAT in the jail. They had to do a cell extraction. Basically, they threw open the door, shot a flashbang in the cell, and had to physically remove this man who was kicking and screaming just to get the tray out of the cell. And Amanda was so upset when she came back to work, a few days later, because she was like, I would have been able to get that tray away from him, because she just was so patient and, had a good rapport with this particular inmate. So it's experiences like that, compounded on top of experiences like that, that just make an inmate more likely to be moved up to a more restrictive environment. So sometimes a mentally ill offender is sent to a supermax prison to protect themselves from other predatory inmates, or they may be a predatory inmate themselves and they might need to be moved up to protect other inmates. either way, there have been a lot of research that shows that mentally ill offenders should not be in a supermax prison. And there was actually a Supreme Court case in 1995 where the justices ruled that it was a Eighth Amendment violation to willingly admit a mentally ill offender into a supermax prison. That is because research indicates that experiencing what life is like in a supermax prison can worsen your mental illness. So people without a mental illness that have prolonged experiences in supermax start to develop the symptoms of someone with a mental illness. And someone who does have a mental illness, their symptoms usually get a lot worse in this restrictive environment. So supermax prisons have to sort of deal with dual goals or face two critical issues. They're trying to prevent the development of mental health issues among inmates that don't have mental illnesses, and they have to try to manage the inmates that already have mental health illnesses and to try to make them not worse. So, because of this, supermax prisons usually have a lot of psychiatric personnel on staff. So, this type of custody, supermax custody, has been widely criticized for worsening inmate mental health. So, because of that, what we're going to do is look at a content study published in 2014 about the policies that they looked at 42 supermax prisons around our nation, and we're looking at the policies on what they do for placing someone with a mental illness in a prison, in a supermax prison, but also how do they evaluate and what do they do? How are they, evaluating their inmates' mental health symptoms, and what do they do if someone starts to experience mental health symptoms? So let's start with placement. So because of that Supreme Court ruling, only 19% of supermax prisons have specific policies for actually allowing someone with a known mental illness into their supermax prison. The vast majority of supermax prisons will not allow a transfer of someone with a known mental illness. So they will not allow someone with a known mental illness into their facility. Only about 19% of them actually have specific policies for allowing that. So here's what those policies look like. So if you want to take an inmate that you know has a mental illness and transfer them to a supermax, you have to submit a written notice of request, and you have to provide evidence from the correctional officers as to why you cannot handle this person in your own facility and why they need to be moved up to supermax. So that written request and that evidence then goes to a classification reviewing committee. If they agree that this person can be moved, then you need an okay from the warden of that supermax. So it's got to go through several steps. That's how they're avoiding being in non-compliance with that judicial directive from the Supreme Court. So like I said, only 19% of the prisons will actually allow you to bring in someone with a mental illness into their supermax facility. And they have very strict policies. You have to provide a written request. You have to provide evidence. It goes through a classification reviewing committee, and it has to be approved by the warden. So that's how they're avoiding being sued. So, evaluation. How are these supermaxes evaluating their inmates to make sure that symptoms aren't, that someone's not developing the symptoms of a mental illness, or their symptoms aren't, getting worse? So only about 55% of them require a preliminary or an immediate mental health evaluation. So that means about 55% of supermaxes, whenever someone new comes in, they give them an immediate mental health evaluation to sort of get that starting point. Only about half of them actually do that, which makes no sense. How are you going to track if they're getting worse if you don't have that starting evaluation? That's like a pre-test. Like when we talked about some research design stuff, if people only have post-test, how do you know if someone got better or worse if you didn't have a pre-test? So what the rest of them do is just a routine mental health evaluation, either, every couple of months or once a year. And another concern is only about 17% of them actually have mental health professionals giving that evaluation. So, reactionary strategies. What do they do if someone starts developing the symptoms of a mental illness? So, about 24% of them have a mental health watch. If an inmate starts displaying early symptoms of a serious mental illness, so they'll just kind of put them on like a watch. And only about 14% of them have specific directives for transferring them to a mental health unit or to a mental health facility or to a different correctional institution's mental health facility. The most common reactionary strategy is to just have them talk to the psychiatric personnel on staff. So basically, they don't do a hell of a lot if you start developing the symptoms. All right, questions? No questions? All right, so don't forget to submit your policy brief today. That is due today. You also need to take your quiz sometime between 10 a.m. today and 10 a.m. tomorrow, with the exception of Zachary Brewster, Grace Cooper, Gavin Crawford, and Bryce Gambrell. We don't have Bryce. I saw him. I think he literally.
What?
Bryce, where are you?
I'm right here. It's Thomas.
Okay. All right. Don't take your quiz today. You're playing Jeopardy on Monday.
Okay.
Excellent. All right. Zachary Brewster, Grace Cooper, Gavin Crawford, and Bryce Gambrell. Everybody else take your quiz. You four are going to play Jeopardy on Monday. Any questions for me? All right. If there's nothing else, enjoy your weekend. Submit that policy brief. And that's like a really big assignment that you are going to be done with. So congrats on that. See everybody on Monday.
Thank you, ma'am.
Yep.
Dollar.
What's up, Sam?